This is awesome. It's awesome to be here. We are here on planet Earth from Virginia Beach. This is Michael, the host of Planetary Health First, Mars Next. And we have some super amazing people here from Israel doing some great things. We got a founder and we got a partner, general partner out of Grove, BC. If you can introduce yourself real quick, Adi, before we get going, and then you as well, Renana.
Sure. So thank you very much for having us. I'm Adi Wallach. I'm the CEO and co-founder at Calmigo.
Hi, Michael. Pleasure. So I'm Renana Ashkenazi. I'm a general partner at Grove Ventures. We're an early stage tech-focused fund based here in Tel Aviv.
I love Tel Aviv. Everything that comes out of Tel Aviv when it comes to tech to America is super amazing. So it's like that branding, that ambassadorship is just incredible. So how'd you find each other? Like you guys are really saying no a lot. So this is like, you are very picky, VCs in general. So tell me about that founder story, your partnership, how you guys discovered each other.
It's actually going to be the first time that I hear Adi tell the story, because I know my side of the story. I think that what happened was one of my partners told me about this company called Calmigo, and he said, it's something in the mental health space. I think you're going to love the founder. I don't know much about it, but you should probably meet. She doesn't live in Israel, but she's here for a couple of days. Hunt. And we scheduled a meeting, and comes into the office this super energetic creature, tiny, but fills the room with energy and a ton of passion, and this light in her eyes, talking about what she's doing. And I think I heard every other word, because I was so focused on her and the way that she was delivering the story, that I don't know that I came out of the meeting fully understanding the story, but I said, okay, let's have a second date. And that's how it started.
Yeah, so first of all, I never heard it from Renana. I can say from my side, so I heard about Grove, venture, like a lot of good things from the ecosystem in general, and then met one of our investors and asked him if he can introduce us. He reached out to Renana as partner, and this is kind of how it started. From my perspective, I'll say, Renana, I don't know if you remember that or not. I came in a rush to Grove office after we had something going on before, and I came in a rush with that and kind of needed to place the batteries near and in the device itself. So it was kind of a very kind of a rushy moment for me. But what I felt from the very get-go about Renana, what's special about her, and after that about Grove. As well as kind of really the curiosity and really kind of the wish to really understand what we are doing. And I remember Renana telling me at the end of the meeting, I'm not sure that I fully understand, but I want to I want to learn more. So this was the very beginning.
Yeah, Michael, I just have to add to that oftentimes founders ask what should be presented in the first meeting, right? I mean, you don't want it to be too long, you don't want it to be too short, you want it to be concise, but you want to deliver all the important notes. And I always tell founders that the only thing you want to get out of a first meeting is the second one. And so you don't need to tell the full story. You don't need to cover every aspect. You don't need to answer all the questions. All you need to do is be interesting enough, intriguing enough, different enough to be eligible for that second meeting where you could double click on whatever's interesting. But really, when you look at, you say we meet a lot of teams and we say no a lot. That's true. But if you look at the numbers, you'll see that, and that's true across all funds, that when you look at the funnel, then we'll meet about 1,000 founders a year or 1,000 startups a year. We'll meet for a second meeting, probably 50, 60. I mean, less than 100. And then we'll invest eventually at about 8 to 10. So really the biggest cutoff is between that first to second meeting.
I love how you say that because I had no idea. I've learned so much from this podcasting. You know, the mythics, the whole hidden thing between VCs and what it is, and you know, I just recently really heard about that, and I was at you know, San Francisco SF, the JP Morgan, and I heard I really heard that from a panel discussion from a VC that really it's all about really is that second date, like you say. It's like really you're just discovering that. And so I think sadly enough, so many founders have no idea that that's the purpose of that call is just to get the second meeting. And we you know, you're not going to write a check or wire. I mean, you know, it doesn't work that way. So thank you for so clearly from a VC telling us. And but what I'd love to get into a little bit is this amazing founder that you guys have discovered. You're working with each other. I'd love to know your journey, Addie. Like where, like obviously we know mental health is huge. It's a problem across the world, the globe. Why you? How'd you get into this? Is it a lived experience from family? Are you a techno wizard? How tell us your little founder story. I know it wasn't just an overnight success, so please, you know, take your time, and we'd love to hear it.
Yeah. So I was in a conference recently, and someone there said that people in the mental health field, they like founders, they either worked in the system and want to change it or add their own experience with mental health. So I'm the latter. I started to have panic attack when I was a student. And at the beginning, I didn't even know that it's panic attack, but I found it out. And I really wanted to avoid medications because as a daughter to a physician, I usually check all the boxes in the side effect manual. And I was very afraid of that. So I tried any other solution that I was able to find, whether it's I went to therapy and to biofeedback therapy and went back to yoga, changed my nutrition, acupuncture, really everything that you can think of, relaxation techniques 3 times a day. And what I noticed is that while all these solutions were able to reduce the frequency of the attacks, they didn't eliminate them. And the other thing that I noticed is that I wasn't able to use these tools to a successful degree in the moment. And this was very frustrating for me because I knew yoga and relaxation techniques since a very early age. And even this was part of me, even before I had panic attack, I was not able to use them successfully, as well as the other kind of method that I learned during this period. What I also noticed is that my life from the outside looked the same, even good. I was a student, even a good one, I would say, for the story. And I managed a team of 7 engineers back then. So from the outside, you would think that everything is great. But for me, my life was very different back then because the fear of when the next panic attack is going to catch me was all the time there. So I stopped, and as a result of that, I stopped doing or avoided doing things that I thought may trigger an attack. So I stopped going to swim because I had one panic attack in the swimming pool. My first panic attack was in the movies, so I stopped going to the movies and so forth. So for me, as an very independent person, it was something that really kind of changed how I lived my life. Fast forward a few years later, after it used to be mainly at night for me at this period, and I used to wake up the person that is now my husband to help me stop the panic attacks. And one Saturday morning, after a terrible Friday night of many attacks, I woke up and I said, how come that I need to wake him up to help me stop panic attacks if everything he knows about anxiety, I taught him? I told him what to tell me when I'm having a panic attack, so why I cannot do it by myself? And at the same moment, I understood that when we are so overwhelmed, we are not able to do even things that we are well trained in. Today, I know to explain the science. Back then, it was just kind of my understanding of what's going on with me. And also at the same moment, I decided that what I want to do in life is to create products that people can take with them everywhere they go, and use it in order to calm themselves down without being dependent on medication or on other people. So this was kind of this Saturday morning and how it all started. After that, of course, came a long research. First of all, we understood that my personal story is not so personal. It's actually the story of 30% of the US population. So this was one moment. And also we learned that what I felt as a name, it calls avoidance behavior and so forth. So kind of, first of all, the first thing was to understand, is it really a problem or is it just my problem? And then also to look for a solution on how we can create this product that will really enable people to calm down themselves in just a few minutes, also during this kind of very stressful moment that they are so overwhelmed, they are not really themselves. So I'll stop here because I talked a lot, but this is kind of how it all started for me.
Yeah, no, that's very helpful. Really appreciate it. So definitely from your lived experience, sounds like you were really engineer. So by training, so obviously you've put your engineering background to build this product, and I could only imagine the prevalence of this condition, worldwide and within the U.S. We're talking. What is the prevalence of this?
Yeah, so we're speaking about over 30% of the US population suffering from anxiety, over 25 of the adults in the US consuming psychiatric drugs. So we're doing about, like, when we are talking about it, it's all like there is epidemic level of people suffering from anxiety. And I'm not even talking about like PTSD, the other kind of conditions, and also rising amount of people consuming psychiatric drugs because there is lack of solutions, if you will, that provide the immediate relief.
So when you went out to solve your own problem, were you at the get-go, how could you do this where it was going to be non-pharmacological? Is that kind of tell us kind of your perspective?
Yeah, so because of, and this came from my own fear of using medication, and I must say that I think that it's amazing that this medication exists. There are people that need them. I'm always saying that it's not 25% of the US population, but it's great that this option exists. But we did want to offer an alternative for Mesa first, and then when we understood that it's such a big problem. And going out of that, we try to understand, okay, so what do we need to do in order to be able to create a good enough efficacy, if you will, for people really will be able to calm down. And what we understood quite fast is what we need to do is to activate the parasympathetic nervous system. So we have in our body, we have the sympathetic nervous system, which is the system that is responsible for the fight or flight response, if you will, for stress. And we have the parasympathetic nervous system, which is the system responsible for the rest and digest mode for relaxation. And we understood that if we can activate the parasympathetic nervous system very fast, this will enable people to calm down and to go out of this fight or flight response. So this was the first step. The second one was to understand, okay, so which methods we can implement in our products in order to make sure that we activate the parasympathetic nervous system very fast. And this is how we came out with like the 3 methods that we currently implement that, and I'm happy to speak about it. And by using technology, we took this method and made them much more effective and also accessible. So people can use them in the moment in order to calm themselves down without the need to, as I mentioned, kind of to be dependent on other people or medication, again, if this is something that is suited for them.
So how do people utilize it? Is it on an app, and is there like breathing exercises with some algorithms in there? I know you gonna be careful with your special sauce and all with your VC on the call right now or on the, but what is it? What does it look like? What's that user experience to how it works? Is it daily or is it, how does it work?
Yeah, so this really depends on if to go to what we are doing today. So today we serve like very wide range of population, from people who are just using it to be the best version of themselves, if you will, musicians that using it before they go up the stage, people who are in stress and chronic stress, and up to people with kind of panic attacks, full-blown PTSD, and so forth. So we serve all of them, or people with specific phobia like driving anxiety. And the use is different between the different kind of situation, condition. What is true for everyone is that we instruct our users to use it in the moment whenever you need an immediate effect. So it can be whether you are before an important meeting and you want to be at your best, or if you have a panic attack and you need this immediate solution and something that will calm you down in the moment, or you woke up in the middle of the night from a nightmare because you suffer from PTSD. In all these situations, you want the immediate effect. Additionally, we recommend a regular use, and we already demonstrated by 5 clinical studies that a regular use lead to significant reduction in measures of anxiety, PTSD, stress, and burnout, and significant increase in psychological well-being. So we instruct to do both. When it comes to the method, as you asked, so we have both a device and an app. The device is our therapeutic tool, if you will, and it works by implementing these kind of 3 methods that I mentioned, and I'll do it very shortly, but it's adaptive breathing regulation, or more specifically, adaptive exhalation prolongation. And our devices guide the user how to extend their exhalation lengths using a proprietary algorithm that we developed. Grounding, multisensory stimulation, which is another method, and olfactory stimulation. So this our device is working, and by implementing these 3 methods and making them effective and accessible, we are able to activate the parasympathetic nervous system in just 3 minutes. The app, what it does is to create the habit of regular using the device in an enjoyable way through a therapeutic game that we developed that is connected to the use of the device. So they work together. The device provides the therapeutic tool, the main therapeutic tool, and the app creates the habit of regular use and also adds some additional therapeutic effect as well.
Now, are you in the U.S. yet with the VA? I'm thinking of like the Veterans Health System.
Yeah. So we are working today in the U.S. through a healthcare organization. Among them is the VA that fully subsidizes Calmigo for veterans suffering from anxiety and PTSD, and also through health plans.
This is great. So I also imagine you're looking at other, I mean, why wouldn't this help with ADHD or other conditions? Do you have other modalities or other, conditions that you see that there could be opportunity that using your techniques?
Yeah, for sure. So when it comes to marketing, we are currently focused on kind of the mental health market, but we already have good experiences with the markets that you mentioned, and even clinical studies with some of them. And the reason for that is, as you guessed, is that because what we are doing is to activate the parasympathetic nervous system, in any situation in which the activation of the parasympathetic nervous system is helpful, this is where our product is helpful. So it can be anxiety and PTSD, but also ADHD, as you mentioned. So we have people with PTSD and children who are using it both in order to decrease their level of anxiety because there is high comorbidity, but also in order to increase their focus, and it's working very well for them. Also for insomnia, for gastro issues, and so forth. So definitely, and this is something that we definitely see ourselves expanding more and more in the future. Currently, and my VC is here, we need to stay focused, and this is what we're doing because it's important for us as a startup.
And then you have this guy, this podcaster who's all over the place, and I'm thinking right as you're answering the question about addiction. I mean, really, if what triggers addiction, and I could see this being hugely successful with that. I mean, if you're able to anyway. So let's steer it back to our wonderful VC here, Renana. If you want to share some things that you think we should be talking about, so glad you're here with us.
Well, I think this is a good example of thinking through how we make a decision to invest. You asked before, what was it about Adi that was different? And yeah, I mentioned she's super energetic, very passionate, and that's very, very clear. But the statistics show that we say no most of the day, right? Most of the people I meet, I don't end up investing in, and really the sad truth is that if I would say no to everyone I meet, I would be right most of the time, right? If I never said yes, then my hit rate would be better, or my loss rate would be better. So you understand, the numbers would play in my favor if I'd say no all the time. The problem is I'll also not be doing my job, and I kind of like my job. So, and so when I met Adi, I asked the same questions that we typically ask. And if you think about a due diligence process, then it's in theory always the same, right? What are investors looking for? They're looking for a big market. They're looking for a good team. They're looking for a big problem to solve. They're looking for moats. They're looking for the potential for returns within a reasonable time frame. But with every company that you meet, the focus or the major questions kind of shift. They're not always the same, because for some products or companies, it's obvious that the team is amazing, but now the question is the market big enough? For others, it's clear that the market is huge, but it's also extremely crowded, and so it's not that obvious that there's still room to play there. So the question, the focus shifts between companies. And with Adi, I think that it was very clear from the very beginning that everything that we wanted to believe was there. Think about the problem that she's solving, okay? In terms of the market, we have this massive population that is affected, right? So the TAM, market size, is undeniably big and growing, right? Because we're only becoming, I wanted to say crazier, but we're not crazier. We're becoming more stressed. We're suffering more from anxiety. The world is a stressful place, and it's not getting any easier. And you see it in the numbers. And so the market is huge, and it's growing. If you look at alternative solutions, right? I mean, is there a gap in this market? Then obviously there is, because alternatives are either not very effective or drug-based. And that's a problem. That's a problem even if you're not a hippie who doesn't want to take drugs. It's a problem with kids. It's a problem because of side effects. So, and we've seen examples for where you want to avoid medication. And so alternative solutions, nothing ideal. We were sold on the team. We loved the technology. And in terms of the potential, then, you threw at least 4 or 5 additional indications, and we saw that as well, right? So to talk about, to kind of think about our thought process, those were the boxes that we checked through the process: market size, problem, solution, a competitive landscape, and potential.
I think timing's perfect for you right now too, because I think so many people really from the get-go do not want to take pills. I mean, there's not that there's distrust, mistrust. I don't want to bring that up, but my gosh, US is different. We all know they advertise nonstop. And my gosh, if you want to like scare the public, just do it. Let's watch all the pharma advertisements. I mean, it's like, so I think, and I know as a parent, going through this with, like how many kids get on ADHD, and like the efficacy of you hear with SSRIs, whether they work. We don't even test whether we metabolize those things. And I hate to say it, but the reality in the ecosystem now, I think really much differently now after, it just is. It's out there on Instagram. It's out there. Parents really want to make sure, people want to make sure that, a sustainable approach. They're much more, and it's not that they're against. And of course, I'm just a podcaster. I'm not an expert. I'm not a doctor. This is medical advice, but it's just the feeling, the sentiment. If there is a sentiment out there, I think Adi's solution is really remarkably reflective of what there's a consumer desire for that. And and then I think the TAM, and of course I'm not an investor, I'm not a venture capital, but man, I tell you, the biggest, coolest companies like Google or Facebook, there was no TAM. They didn't even know what it was. So I guess that's the other wild card for you as a VC. Is this such a crazy thing that could be just, and I guess that's a hard one to find, those companies out there, but I'm sure every once in a while you get something very close to that where there isn't a market at this point.
Yeah, but that's actually it's an interesting point because we're living through this. I don't even have the right adjective to describe the times that we're living in terms of the technological revolutions that we're witnessing, right? We've been recording for, I don't know, 10 minutes and no one said AI, but with AI, with Gen AI everywhere, then the question of what's investable, what's fundable, what could be a company that can build a moat and become that, significant outcome that VCs are looking for, it's a bigger question than it has ever been, because nothing is easy, but it's the easiest it's ever been to build technology and to build products and to bring them to the market. And it's only going to become easier. And so when you see a company that can actually hold a meaningful moat because of the technology that's associated with it, even the hardware envelope, the domain, the deep domain expertise required, then that's also extremely appealing. And I think we'll see more and more investments similar to this one versus the pure enterprise SaaS investments that we're used to seeing.
So with this eventually, do you see this as someone is at a psychiatrist, a counseling office, and they get a prescription? Is there an element for that as well?
Yeah, so I want to say about that actually exactly when you spoke. What's good about Calmigo is that it doesn't require a prescriber, so it doesn't add a load on the system. Because another problem that we didn't yet talk about is how much the system is overloaded, and there are huge shortage in mental health clinicians, in clinicians in general, but especially in mental health clinicians. So one of the things that the healthcare system like about Calmigo is that it doesn't require prescription on one hand. On the other hand, we do see, and this is something that I think amazing to see about the US, about the healthcare organization, clinicians in the US. In the last few years, they are actively looking for drug-free solutions to offer to their patients. It might be as a result of the opioid crisis that kind of brought to the kind of to put out in the open all the problems that we have with medications. Also studies specifically about anti-anxiety and antidepressants. But it is amazing to see how much efforts healthcare clinicians and organizations put into finding drug-free solutions or alternatives. So this is one thing. The way that we work with them, because we don't need a prescriber, so for example, in the VA, there is a referral form. It can be from the primary care physician, from the psychologist, from the psychiatrist, or the veteran themselves go to their clinic and ask, or even through the portal that the VA launched, that they can ask for Calmigo through that. So we do work with clinicians, to your question, but it doesn't require a prescription. Same goes with health plans. They do refer to us, but it doesn't need to go through the prescriber, which take a lot of load from their side as well.
Yeah, it seems like you're doing it in a really smart way. I know for just a simple assessment, for a diagnostic assessment here in this area in Virginia, even with a referral, I think it's like 4 to 5 months in our area to get someone just assessed for whatever those conditions are. And that's just, that you have insurance. So we talk about access to care and all these things. This is for everyone. It isn't just like whether you live in a poor zip code or whatnot. We have a really problem that's exacerbated with mental health too. So all the more reason why you have really different on-ramps, if you would, no barriers. And the one thing that I would also curious to you, there's so much efficacy and evidence that peer support really helps, like the social connectivity, the community. I play pickleball. I think it's my new church, and it's such a bizarre sport. I used to play tennis, and I'm a little older, could still play tennis, but it's the access. Pickleball is just growing so much because there's so many people there. It's a network effect. You don't have to worry about finding someone. You just go, you show up, you get your game on for 2 hours, 3 hours. And, I know I'm like, where is he going? But my point is there's a powerful peer-to-peer community, friend to friend, human to human, and you play and you have fun. Are you incorporating any of that element to your app? Because I know that people's mental health, I know for my own self, the relation aspect is so huge to people doing better in the community.
Yeah, so for sure. So I'll share what I can about that. So far, we don't have a social aspect in our app, but there are some plans to that, to some extent to that. And I will mention that also for the audience who hear us, what you mentioned, actually two things. First of all, is kind of community and interactions. I will call it interactions, human interactions, which are known to really reduce stress and anxiety. And today, and Renana kind of mentioned it, the world that we live in today, we are so much into our digital interactions and not enough in our kind of real human interactions. And we know that for people with anxiety and stress, this is something that is really helpful. The other part that you mentioned was physical activity. So this is also something that also very, very, very helpful. And it doesn't even need to be to play tennis, because if I need to play tennis, it wouldn't no success out of that. But even just to do a walk, after lunch, or just to move your body, have like some fresh air, this is something that is really helpful. So no, we are not yet incorporating that, except for we doing our best also to provide content and tips to our users when it comes to that. But maybe in the next time that we'll be here, I'll have more to share.
Yeah, your VC is going to never let me talk to you guys again because I'm just steering you all over the place. So as we're kind of wrapping it up, any last, like, how people can find you, anything more about your fund as well? I'd love for you guys to just kind of let people know and, where they can find you. And I'll also have a newsletter to follow this actual podcast. So please share with me some information, resources about both of you, please.
So I'm not really the interesting party in this discussion. We invest in Israeli-related startups. I'm always available to help whoever needs a critical eye to review a deck or grill a founder on an idea. So I can be reached very easily through my email and LinkedIn. But the D here is the one to reach out to.
So I'll start by saying that if you are a founder and you listen to us and you are at early stage, so don't miss this invitation to reach out to Renana. If you want to reach out to me, and I'll connect you to Renana, because it's definitely something that change our company looks like, and the support that we receive from Grove, and especially with Renana, we're spending a lot of time with me, and in general, it's something that I think is unique, and also the way that they look at investments. So Renana shared a lot, but you said it's an amazing opportunity, but you also need to look very deeply into things that are not the mainstream in order to be open to things that are different. So this is a lot to say about them, not just about the opportunity that we kind of open here. So this is one thing for the founders who listen. The other thing for everyone else, we are at calmigo.com. This is our website. We offer, as I mentioned, both through clinicians, healthcare organizations, and also directly through our website, and definitely would love to help as many people as we can. Our mission is to make mental health accessible to all populations. So reach out to us, and we are here to help in any way we can.
Cool. Well, this has been so awesome. I really appreciate you two coming today and really enlightening us about the VC process, get that second date, and then everything you're doing, Adi. it's just amazing.
Thank you.
Thank you, Michael.
Thank you, Michael.